Okay, so what we're going to do now is we are going to look at we're going to start sports medicine. So we're going to start basically with the cervical spine and then work our way down. Remember, the cervical spine is the neck. So let's just look at some normal anatomy of the neck real quick. And if we look, this is the head. Obviously, this person is looking this way. This is called a lateral view. And you can see this is the jaw. This is the spinal cord right here. So these are the cervical vertebrae right here. These are bones. These darker brown areas are bones. So as it says here. So you can also say they have numbers. So that says C2, this says C3, C4. And what the numbers do is that tells you where in the cervical spine we are. So there's actually a C1, which is going to be way up in here. You just can't see it right now. So what happens with the cervical spine is we have the bones, and then between the bones, you'll notice we have something called, or these little pink areas. These are called disc. Okay, these are called disc right here. And what discs do is these act as shock absorbers on the spine. We'll be talking more about cervical disc in a little bit, but they act as shock absorbers on the cervical spine. So as you walk or run or jump or anything, basically your head applies a pressure in a downward motion. So to alleviate some of the pressure on these bones, because you need the bones to support your head, these discs act like shock absorbers inside the spine. Okay, so these act as shock absorbers inside the spinal column. Okay, and then a lot of times what will happen is we talked about osteoarthritis and we looked at pictures of it. A lot of times what will happen is these will start to wear off as people get older, simply because of the fact that the discs are, after years of wear and tear, the discs start to tear down. But right now what our interest is right here. And this is the spinal cord right here. Now this is the spinal column. The spinal column is made up of bones, and this is a cutaway. So imagine that this bone surrounds this whole spine here, the spinal cord. Okay, the purpose of the vertebral column, the purpose of these bones is to protect the spinal cord. Okay, and the spinal cord is going to come off the brain and go all the way down to about the beginning of your lumbar spine, the upper part of your back, and then it starts to separate out a little bit. So if we get a fracture, sometimes what will happen is you'll have fractures which will actually go backwards into this area here. And it may actually start to put pressure on the spinal cord and can actually lead to paralysis. And normally there's several different ways that people can get fractures from sports. Probably the most common sport to get a fracture would be football. And it's not uncommon for football. Actually, I shouldn't say it's not uncommon, but it's not unheard of football players actually getting fractures that cause paralysis in their spine. So let's go ahead and take a look. So again, this is a normal. So what we're going to look at now is, you can see on this here, we have a fracture. I have no idea how you would have fractured your vertebrae and just pushed one backwards into your spinal cord. But remember, the spinal cord is made up of nerves. So as this comes back and puts pressure in there, as it comes back and puts pressure in there, what's going to happen is it's going to cause damage to your spinal cord. Now, this may or may not cause paralysis. People think that you have to tear the spinal cord to have paralysis. You don't necessarily have to tear it. You just have to do enough damage to it that the signal can't get through. Because remember, the signal's coming from your brain to go down to your arms and legs and throughout the body. And if it gets cut off here, it'd be like, imagine a freeway and a bridge goes out. That's what it'd be like here. The signal cannot get from the brain down to the rest of the body. So let's take a look at another one. This is looking at an X-ray, and this is a normal cervical spine here. if we look, you can see there's no fractures here. The spinal cord would actually be in this region that's right around in here. If you had anatomy, you've heard of vertebral foramen. Your spinal cord is going to be right in this area here. And remember, it surrounds it. The bones surround it. So these are your vertebrae again. Your disc are going to be in here. So this is a normal X-ray right here. So let's take a look at the next one. And on here, we can see some fracture, right? If we go to right here, we see there's a fracture. So this is almost like what we saw just a minute ago, in which we had that fracture that was pushing back into the spinal column, right? So you can see a piece of bone's broken off here. The spinal cord, once again, is in here, right? So now this is pushing up and backwards into my spinal cord. All right? And I'm not quite sure what this is. It doesn't look like it's broken off of anywhere. And it looks like they might have done surgery on this person here. These could be some surgical wires, but I'm not quite sure what this is. And I'm not quite sure. For all I know, that could just be an earring, but usually they don't let you wear earrings when they're taking X-rays like this. Something else that's of interest is right here. This is most likely the windpipe right here. And then this would probably be your voice box. That's why you can't see through it. And then this is the upper part. There's your tongue. So let's continue on and take a look at another fracture. Okay, so if we look here, what do we see now? We see a fracture right here. If I have my vertebrae here, and you'll notice this one has been pushed forward. Now, two things could have happened. It could have. You'll see this is the vertebrae here. This front part here should be back here. Okay, so you can see it's moved forward this much. Okay, so something that could have happened is we could have had a fracture of the bones that are surrounding the spinal column, and then just this piece went forward. I can't tell from this, but just that piece went forward, which would have left the cervical spine intact. So this person would have gotten lucky because they would just go in and do surgery and they're okay. Not all cervical fractures lead to paralysis. In fact, my guess is that most of them don't lead to fractures. So let's go ahead and go on. All right, here we got another fracture down here, and you can see it, we're pointing to it. If you notice too on this, the nice thing is here against the spinal cord, we haven't damaged the spinal cord. Okay, we haven't damaged the spinal cord. In the last chapter, we talked about avulsion fractures. Sometimes if ligaments are attached on here, we'll actually pull the bone apart, and then this is the fracture right here. This area right in here. So that's an avulsion fracture, or that's what happens in an avulsion fracture. So you can see something's pulled to back it off. Could be a whiplash, which would also be an avulsion fracture. And like I just said, the avulsion fracture is you have muscles and ligaments and tendons connected to this. Let's say someone's running with a football and they get hit real hard and the head jerks forward real fast. Well, it goes so fast that the ligaments and tendons holding on to this don't move as fast. And so they hold it in place. This kind of goes this way. This goes this way. And we get this avulsion fracture here. Okay, let's look at the next one. And that looks like it's it. So there's just an example of some fractures that can happen on the in the cervical spine. So what's the treatment for this? Normally, if it happens, first thing that happens is you don't want to move a person. We don't move them because what we don't want is for them to get paralyzed if they're not paralyzed already. You put a collar around them, you stabilize the neck, you move them, and then you basically need to let it heal over time if it's not that bad. Otherwise, what you may have happen is they may have to do surgery and go in and actually put wire in there and fix it. And so that is it for cervical fractures.